Hello, my name is Dr. Luciano Costa. I'm a multiple myeloma physician at the University of Alabama at Birmingham. I'm here at the American Society of Clinical Oncology annual meeting, where I had the pleasure to present an abstract on a phase 2 study of venetoclax plus carfilzomib and dexamethasone in patients with relapsed and refractory multiple myeloma. This study accrued so far 42 patients across multiple institutions in the United States, and it combines the BCL2 antagonist venetoclax with the second generation proteasome inhibitor carfilzomib. Multiple myeloma cells have several we call anti-apoptotic molecules. So those are molecules that help the cell to stay alive and resist the normal insults that would lead to cancer cell death, including the insults triggered by other myeloma treatments. So by combining carfilzomib with venetoclax, there is the potential that we will negate this mechanism of the cancer cell to escape death driven by carfilzomib. Venetoclax is an orally available agent that is approved for treatment of other blood cancers. In this study, we use venetoclax in combination with different doses and schedule of carfilzomib, and we expand the study using the carfilzomib dose of 70 milligrams per square meter on days once a week for 3 weeks on, 1 week off. We had efficacy data on 30 of those patients who had been on therapy for 3 cycles or more, and we have safety data on now 42 patients. We found that in general the combination was very well tolerated. The side effect profile was very similar to what we are accustomed to seeing on patients being treated just with carfilzomib. We found the activity to be very high. 83% of the patients who had 1 to 3 prior lines of therapy did have an objective response. With the majority of those responses, 57% of all patients had a very good partial remission or better. Venetoclax has been found to be exquisitely active in patients whose myeloma carry a translocation 11-14, which accounts for about 1 in 5 patients. While in this study we saw that those patients had a 100% response rate, all 7 of the patients could respond, we also saw that patients who did not have 11-14 have a very high rate of response. We also saw that patients with high-risk chromosome abnormalities had a response rate greater than 80%, which was very similar to the response rate of patients without high-risk abnormalities. We believe that as this combination gets developed further, it might become a very attractive option for patients with relapsed and refractory myeloma, particularly patients who have disease that has become refractory to other proteasome inhibitors such as bortezomib. Of course, we look forward to the continuation of this study. As more patients progress through additional cycles of therapy, we'll expect to gain some more insight into potential side effects and tolerance to this regimen, and get better numbers of what the actual response rate is going to be when the trial is completed.